very excited to present information on the California WIC Card. I am going to present a quick overview of the WIC program. And I apologize to those who might be very familiar with WIC, but I still wanted to give you a quick overview for those who might not be. WIC is the Special Supplemental Nutrition Program for women, infants, and children. And so WIC is a federally funded special supplemental program. It started 45 years ago, back in 1974. And in California, Department of Public Health oversees the program. PHFE is just one of the several sister agencies that service participants in Southern California. And we're very happy to have also Northeast Valley here with us today. And some of the, the four core services that WIC provides is breastfeeding services and support, nutrition education, healthy food, and family resources. In terms of breastfeeding services and support, I am going to speak for PHFE WIC. If you have any specific questions about some of the other programs, I will be happy to direct them to those specific programs because there might be a slight variation of what we do. So we provide breastfeeding education, electric pumps, breastfeeding support, lactation consultants on site that do home visitations also. In terms of nutrition education, this is provided in groups at the WIC offices, individually one-to-one, as people might need they might need to have some nutritionally related issues addressed with them. So we have RDs at the WIC sites. We have part of professionals that are highly trained also to do this. And then we have our online education. For healthy foods, food benefits are issued monthly to all the people who qualify to receive the benefits. And WIC provides important nutrients that are critical during certain periods of growth, such as pregnancy and from birth up to age 5. So for family resources, we have additional services in the community where we can provide some support to families. In our PHFE WIC offices, we also have some on-site support from Call Fresh, Medi-Cal, Head Start, dental services, and so on. So if you are interested in knowing more about it, we'll be happy to also direct that to specific programs and give you more detailed information on what they might offer, since I'm speaking for many WIC programs here. Who qualifies for WIC? So for WIC, it's category eligible, so basically women who are pregnant, postpartum breastfeeding, if they continue breastfeeding their baby up to the first birthday. For women who just had a baby or lost a baby or terminated pregnancy, they also qualify for 6 months to receive the WIC benefit. And I believe some people might not know this. I don't think we had widely spread this information. So I would like to highlight that if you have a mom who might have lost a baby or decided to terminate a pregnancy also, they do qualify for 6 months of benefits. The infants, they qualified up to the 1st birthday, children up to the 5th birthday. Foster children qualify for WIC services. Fathers may apply for WIC, and we have now many couples that are applying also for services. It could be to moms to dads, and we welcome them. So let me continue. So for eligibility for WIC, basically, like I mentioned, they need to be in one of those categories. They need to be income eligible. They need to live in an area where WIC has an office. If they come to one of our offices and it's another geographic area, we'll be happy to direct them to a WIC office near them. Have a nutritional risk also is one of the requirements, and I mentioned this because sometimes we have children who have anemia. So that is definitely a requirement. It might be a baby that has a failure to thrive. and definitely a requirement. So if we have healthy children, which is always ideal, we could definitely find nutritional risks when we assess their diet at the WIC office, and that will make them eligible. So continuing with the eligibility guidelines, we say that families, we are mandated by regulations and federal regulations that income must be under 185% of the poverty level. However, families with adjunctive medical can qualify for WIC. For foster children, we evaluate their income individually. And one thing I wanted to really highlight is that immigration status is not considered when we are determining eligibility for potential participants. And we're really happy to share that with the new ruling of the public charge determination, WIC was excluded from being part of public charge. So please help us spread the word about that. So now I'm going to pass this to Samar McGregor, who's going to talk about the successes of WIC.
Hello, everybody, and thank you for joining us today. So we talked about WIC and how great the WIC program is, and we all know that WIC is great. But we need the studies to support us and to show and showcase why WIC is so wonderful and important for the health and well-being of our families and communities. So I'm going to highlight a few studies that have been recently published about the WIC program, and those are available on our website, and you can see it on the bottom right-hand corner, and you can go under research and evaluation, and you can find these studies. So the first one that I wanted to highlight, and this came out just a few months ago, which showed, and this is a repeat of a study that was done in 1970, something about when we used to say that spending $1 on WIC or on WIC resulted in $3 of savings in healthcare. And now it's showing that it's resulting in a mean savings of $2.48 in healthcare. So that's still big. That really shows when we're talking to legislators about WIC and why it is still important to fund the WIC program. The next study that I wanted to highlight is how WIC has impacted the declining rate of obesity in preschoolers, and that's also highlighted because as Pina will talk about the food package, and some of you may know about Pina mentioned the benefits, and we now, well, we call them food package and soon to be benefits because we're going EWIC and EBT. But the foods that we provide on the WIC program are scientifically based, and the what used to be the Institute of Medicine, which is now the, oh gosh, I cannot think of it right now, but the National Academy of Science, Engineering, and Medicine did the study about 10 years ago. We're due for changes in the food package or in the food benefits, but at this point, it's not going to be, due to several reasons, the USDA is not going to embark on that. But there is a reason why the food benefits are so important. There, as some of you may know, we offer foods that are rich in protein, iron, vitamin C, whole grains. And so that plays a big difference. We give still a bit of juice that I know that the AAP, the American Academy of Pediatrics, does not really support us on, but we've gotten better. We don't give as much juice. And we give our nutrition counseling on that based on the fact that we'd rather offer the children water or milk rather than just giving them juice. But anyway, the study shows that there is a decline in obesity rate for preschoolers. The other thing I wanted to highlight is our Los Angeles WIC data. This is in collaboration with First 5 LA. We got funding to do the data mining, and so that's available also on our website. But it also shows you can get data, and this is for all LA County data because it is it encompasses all 7 local agencies in LA County, the data from 7 local WIC agencies. And it shows that currently there's a 20% of 3-year-olds are obese versus 22% of 4-year-olds, but also that shows a decline as well. So there's a lot of data for the LA County WIC data, not just for obesity, but a whole bunch of data that you can have access to on our website. Another study that is the Center of Budget and Policy Priorities is always publishing articles about the WIC program, and that is a historical data that is historical data about how participating in WIC as a prenatal for the prenatal our prenatal population, it improves in birth weight and it reduces the risk of adverse birth outcomes. We do a lot of education with our moms about signs of premature birth and making sure that they go for their prenatal checkup. The food that we provide is healthy foods, and we monitor them constantly when they are pregnant. So and it shows, everything that we do is showing in those studies. And we've been in existence for about 45 years now, and we have really impacted the health and well-being of our families.
Okay, so I am back here. So basically, we have very easy ways to apply for WIC. And like Samar said, I just really want to also illustrate this again. If you want the WIC data from data mining, you can find a link from our PHFE for our website. So if you would like to look into more data of what we've done for the last, I don't know how long we had it, but the last
15 years.
15 years or so. So there's a lot of wonderful information that can be, assessed or utilized if you need to. And then we also have to applying for WIC, they can apply at our website. We have an area which says apply, and it's apply button that we call it. People can leave their information there, and somebody will call them back to ensure that they come to the WIC program with instructions on how to. They can also call a regular line. And again, we have the text apply. If they text us also, somebody also will respond to them and initiate the process to get them into the program. I want to also just mention, if you have any questions and you want to type your message, we'll be happy to take them. We have someone that can support us here collecting those, or it can happen at the end. Either way is fine, but I just wanted to mention that. So we are really excited now to present the California WIC Card, and it actually looks like that card that you see in the middle. It's very colorful, it's very appealing for fruits and vegetables, and we're so happy to say goodbye paper checks that we had for 45 years, and hello, the WIC Card. One thing I want to mention is in Southern California, since I understand that many of you are working in different areas, the program is going to implement the card. The state is going to implement the card in 3 waves. So we are coming up with the first wave in Southern California. November 11th is our first day, and then December 9th would be our second wave, and January 21st will be the third wave. So that's how it's going to happen. Just to paint a little bit of the picture of what areas, the wave 5 is South Bay area, kind of Orange County areas. That's our wave 5, and then it moves up geographically to LA and going up, including the Valley, probably you guys will be at the end. San Fernando Valley on January 21st. So WIC participants be able to go get a WIC card to a different WIC site or program. It's sad to say, but no, they have to wait until it comes to their area, their location, because of the record transferring and everything. So they must just, I consider that good information for you to know, just in case. So we basically, what we're doing is we're transferring records of the current participants that are coming to WIC and the areas that are going live. And the stores too, the same thing also with the stores. So just to illustrate that.
They can take either though.
Yeah. So for the California WIC Card, we're really happy to say that it's going to be an easy shopping experience. They won't have to show no more paper checks of the WIC folders, which were long WIC folders that they have to present at the stores, and they were comparing signatures, no more signatures to compare. If a participant loses the card, the benefits can be replaced. That would be not a problem. It can be used as a debit card with a 4-digit PIN, and which it makes it secure. Unless they give that PIN to someone, no one can use their card, and it gets invalidated after X number of attempts. So it's totally like a debit card that is secure. They can buy food quantities as needed, unlike in the past, if we had a check where the check was specific for 2 pounds of cheese and 2,000 eggs, they had to buy the whole quantity at once. And we are so excited and happy for those families that have issues with either sharing a house or an apartment at home with another families, and they're sharing also a space in the refrigerator, so they could go buy as they need, which is really great. We have the WIC app to assist with the shopping and with appointment reminders. So I'm going to show you next what a receipt will be when they go to the store. We're really excited about this because it's very easy. Our families sometimes will have a hard time understanding what to buy with the checks. So when they go and buy their food, they can, the receipt would list what they bought, how much they paid, if there was any discount, because things that are discounted also should apply to WIC, or if they bring coupons. And then it has their total purchase. It tells them when the benefits expire, which is really good, it's in the receipt, and what benefits still remain on their card. So you can see clearly in the receipt that they have all this information in that receipt. So somebody asked, what if they lose this receipt? Can they find out what is left? And yeah, definitely. I'll talk about that in the next few slides. So the WIC app, that is just the face of the WIC app. It has appointment reminders, so people will get appointment reminders. Our new system is very much appointment-based. So we were really trying to get people to come to their appointment time. Although for those that are unable to, we have slots that we have assigned to them, but it will be preferable if they came on their appointment time because they can be served faster than if they show up. We might not have an immediate appointment available within the next hour, so they might have to wait 2 or 3 hours. We're hoping that it wouldn't get to that, but we have done a really good job, I think, in the last 6 months as programs informing people how to prepare and about their appointments and so forth. The app also has the UPC scanning. They can check what foods they can get. I think it's nothing more embarrassing than being at the checkout counter and then being told, this is not allowed, or you cannot buy this food with your WIC checks. I had witnessed that many times, and I'm so happy that we have this feature because it's really going to take that stigma that I am using a public benefit. 1, I have a card that looks like a debit card. 2, I already know what I need to buy, and I can select the right food. The app also has the WIC office locations, and they have what stores they can go shop for their benefits. You will see that normally when I'm presenting for an audience and I'm in front of them, I can show that app on my phone. But what I did is I put a couple of slides just to give you a little preview of what the card has. So it has the WIC locations. I am where the blue dot is, and all the red pins show with a WIC location is near me. When they click on the pin, it shows an address of that location. So it's really simple, and it shows them within 60 miles what do they have near them. And it's not exclusive to a program. It's just all the different WIC programs will be listed in this in the app, which I think is really great. For food balances, we talk about if they lost a receipt, they can check food balance in the app, and it will tell them what they still have left in the card to buy. So we're making it a lot easier and going really with the times now, right? So how do you connect people to us? Again, our website. They can send a text message. They can call us. We are also in social media. We're in Facebook, Instagram, and Twitter. And in social media, we have several languages. We have Vietnamese, Arabic, we have Korean, and Chinese. So we are also present in those 4 languages, and that are very, very popular. So if you have other ethnic groups that would like to know more about WIC and what's happening, you can also direct them to the social media. So it's almost here. We're so excited because by next week, our first wave of centers, will be on already on the new card on the 11th. So please send your clients to come now. One of the things that are important is that it will be a lot easier for participants to have all the information up to date. So if they come to see us before those days, it will be great. However, I gotta say this, if they come in November, they will not be able to get in November their WIC card. They will have to wait until December, but their information will be up to date. So anyway, we welcome them either, this month or next month. The one thing I wanted to mention is that some families have stopped participating in WIC. We think there are different issues, different reasons why people stop participating. It could be from the stigma of using paper checks at the store. Sometimes people looking at them. Sometimes it could be related to immigration. We have heard just so many different things, and we are hoping that at least with the card, we solve some of those issues. So we want them to get the WIC benefits. Please refer them to WIC. One of the things I would ask them if they are on WIC, and if they said yes, ask them when was the last time they cashed checks. If they said, oh, it's been a while, or it was like a few months ago, that means they consider themselves being on WIC, but they haven't been to a WIC office. So they deserve to be on WIC. Their kids deserve to be on WIC. And I really just ask them to have them come to WIC, get the WIC card. We welcome them at our WIC offices. I mentioned the different ways how they could come and get the WIC card. So now I'm going to leave it for questions, unless Sharon has anything to add in terms of her home visiting program.
Good morning, everyone. I want to also invite you to ask any questions that you have for us. We're real excited about this new rollout in terms of the cards. We've worked closely with some of the home visitation programs. I think our experience with some of the Welcome Baby, outlets is, could be improved. And so I think this is the first step in that. And so we're hoping to, take it from here and let us know how we can pick up from there in terms of the referral process.
Okay, I believe that concludes our presentation.
I mean, maybe we're on mute. Steve, are you there?
No, we're not on mute.
Are the attendees on mute, though?
Yes, everybody is actually muted. So if anyone has a question that they would like to ask over the phone or make a comment over the phone, you can use the hand raising function and I'll unmute you. I mean, unfortunately, when we unmute everybody, it seems there's always feedback and background noise. Sometimes it puts us on hold and we hear the hospital's elevator music or whatever. So we do have everyone muted. But if anyone would like to make a comment or ask a question to Pina or Sharon, any of our WIC representatives about the card or the app, initially, if we could just get the questions on that, just raise your hand. And if you don't see that, I think it's the bottom little button on your left side the right side of the screen, sort of the top right in the webinar. There's a little hand there. You can just raise that, and I will unmute you. And I don't see any hands raised. Anybody have anything about that? It was a very thorough presentation, but there must be one question or two.
One thing I do want to mention, if anybody will be interested that we come to a specific group or a hospital or, other audience that might not be here and they would like us to come and present, we'll be happy to do that too. So just to put that out there.
Great.
And I really want to thank everybody for,
And then, Steve, can I make this announcement too? I think that while we have tried really hard to, make our participants aware of this card, there's a lot of people who don't know. I mean, when we're out in the community and things like that, we can't assume that they know that this is coming. And so there wasn't any big campaign or anything where that got highlighted.
Yeah.
So we really appreciate anything you can do to help us with getting the word out, because it's got to be by word of mouth. And that's where we are with that.
Yeah, absolutely. I agree with that. And we really thank you for listening to this information and helping us spread the word and pass it on to more people, because that would be probably the only way how they might get the information. Like you said, unfortunately, the state did not do a campaign on this. So we're trying to do that first with community partners and pass this information to more people other than also our WIC site.
Great, yeah, definitely.
And if anybody
sorry, go ahead.
Sorry. If anybody's interested also in getting more handouts and more information, please also let us know. We'll be happy to produce more information, more material.
Yeah, we will send around. I know, Pina, you shared the flyer with me and the other handout, and those two, as I said at the beginning of the call, are posted in the webinar there. If anybody wanted to just click on those, you can get them now, but I will send those around in a follow-up email. And if there are other WIC materials that you'd like me to send, Pina, we can do that as well. As I mentioned, this is being recorded, so we will post the webinar recording. And I encourage everybody who's on the call to bring it back to your agencies or hospitals and make sure that the home visiting staff knows about the rollout of the WIC card and app as well. I have a quick question. When it comes to families getting the card, actually going to a WIC office and getting a card, do they make a special appointment for that, or what's the best way to do that so you're not swamped with? I imagine it's going to take some extra time to issue the cards.
Giving us a phone call will be great, because our phone department has the capability also of working with some appointments and giving the person, even though she didn't have an appointment, she might be able to get an appointment before she goes in. But if they're unable to and they walk in, they might just have to wait a little bit longer. Texting us also is a good way, especially if they have been on WIC. They can text us and we can arrange also that part. So we're really trying to help everybody. And this is going to be a transition, because we're not only just having a new card, our whole system, how WIC operates, is changing. So it's a whole new computer-based program, and we're converting the files, but as the person walks in, we have to update quite a bit of information. So the first time might take a little longer, but we will be more efficient as time progresses and we provide the services. But we welcome anybody to call us, text us, go into the website if they want to apply. We have people in all the different areas assisting them.
And I wanted to add, Steve, one other thing is like, I think a lot of families, especially maybe not be getting, let's say, whole foods. And And there certainly, when you look out on the ground, and a lot of us are on the ground, your people and us as well, and we see the people that walk in, and we can see that people are having a hard time. There's a lot of difficulties families are having, and certainly we want to meet them in terms of gaps, in terms of need, and I really think we need more like in the home visitation program. That's what makes you guys such an ideal partner, because sometimes they're not taking advantage of the resources they could be. And we certainly have a lot of the communities that we're seeing. We see that we have a lot more people that qualify for our program that don't participate, and that's an easy resource that they could. And so that's why we're really taking the time to really kind of emphasize some of these things, because they'll tell you sometimes, I use WIC before, but they haven't been in several months and haven't taken advantage of it. That's what we're seeing.
And adding to that, the fact that they trust your program very much, they're allowing you into their house, it makes a huge difference when you remind them, when you tell them. You know, I think people do listen to people that they trust, and they will feel more comfortable. It will ease off a little bit of that anxiety of participating in programs, especially when it comes to immigration. I'll be happy to send you a flyer so we can share with the audience about WIC not being included in the final ruling of what programs make a public charge. They can share this with them, and it will never affect them participating in the program as the ruling is stated, unless that changes in the future, but we're hoping that wouldn't happen necessarily. But where we are right now, we are a safe program to use, and I will send that, and I encourage you to talk to families about that, since you see the families in your home visitation program. So, and we thank you for supporting WIC with that.